Vaccines only work if you actually give them. And we know your record on this. We rely on the Advisory Committee on Immunization Practices, a panel of experts to recommend which vaccines people should get at which ages and the like. Now, I know Senator Cassidy had concerns about your views on this, and so when he voted to confirm you as Secretary of HHS on February 4th, he explained that decision by saying on the Senate floor that, quote, if confirmed, you will maintain the CDC's Advisory Committee on Immunization Practices without changes. But then 2 weeks ago, you fired all 17 experts on that very committee. Mr. Secretary, question for you. Did you lie to Senator Cassidy when you told him you would not change this panel of experts?
I never made that agreement.
So are you saying that Senator Cassidy lied when he was on the Senate floor, lied to the American people?
I didn't see that statement by Senator Cassidy. I've only heard it from you, but if he said that I agreed to it, it would be inaccurate. I made an agreement with him. I made an agreement with him, and he and I have talked many times about that agreement.
My time. I just want to tell you that for most of us sitting here right now, we believe Senator Cassidy more than we trust you when it comes to vaccinations. It sounds to me like you gave him the answer he needed to hear in order to get his confirmation vote, and then as soon as you were Secretary, you turned around and did whatever you want. You fired all 17 members.
I'm complying with all the agreements that I made with Senator Cassidy.
You're now on the record. You lied to Senator Cassidy. You have lied to the American people. You have lied to parents about vaccines for 20 years. And I also want to be clear that I will lay all responsibility for every death from a vaccine-preventable illness at your feet.
Health and Human Services Secretary Robert F. Kennedy Jr.'s new Vaccine Advisory Committee is set to meet today for the first time. Last month, Kennedy fired, you'll remember, all 17 members of this group and replaced them with 8 of his own. One withdrew this morning. And when firing the last ACIP panel, as it's called, Kennedy said that that committee had been, quote, plagued with persistent conflicts of interest. Well, on Tuesday, Democratic Senator Elizabeth Warren actually sent a letter to Secretary Kennedy saying that this new panel that he has picked was rife with conflicts of interest themselves, and that Kennedy, quote unquote, handpicked these new members to further his anti-vaccine agenda. Republican Senator Bill Cassidy is also sharing concern about the makeup of the group, writing that some of the new appointees, quote, lack experience studying new technologies such as mRNA vaccines and may even have a preconceived bias against them. He's called for today's meeting to be postponed. Joining us right now for more on what this means is Dr. Paul Offit. He's the director of the Vaccine Education Center at Children's Hospital of Philadelphia, a member of the FDA Vaccine Advisory Board. It's good to see you, Doctor. You, like Republican and Democratic senators, as I was just showing, have a real issue with the makeup of this new vaccine committee. What do you see here?
Well, this committee, as it's currently constructed, would never have passed the normal process to get on to be a voting member. You really have to show some expertise, some experience in the field in order to be able to give it good advice. And that is not who this committee is. So I think we are about to get some very bad advice from a group that shouldn't be giving us advice.
And on the issue, as I was laying out, of Kennedy has said previously and said again yesterday in the committee hearing that he fired the whole panel, which was really kind of unprecedented, and replaced them. The reason being is conflicts of interest. And in this hearing yesterday, he said, I fired people who had conflicts with the pharmaceutical industry. Is that the case?
No, it's not the case. And what he should be held to is name one person who has a conflict of interest, one person who, because they are being funded, say, by the pharmaceutical industry, that has influenced their vote, because that is true of none of the 17 people that he just fired, which is why he does this sort of vague, hand-waving, slanderous statement instead of pointing to anybody in specific. It's awful. And so what he did was he just fired a group of people who had the expertise, who had the experience to give us good advice, and replaced them with people who don't.
CNN has also new reporting that, and this speaks to some of the people who may be on, who are on this committee, is that a presentation slated to be shared in this first meeting, that it was posted online yesterday, does not appear to exist. CNN's Meg Terrell had really great reporting on this, that the author cited of this supposed study, she contacted this person and he said that it's not his, and it comes to a wildly different conclusion than an actual study that he had conducted and that was actually published. Without going into the detail, the non-existent study, if I sum it up, suggested a connection to autism in terms of a preservative that can be put in some vaccines. The actual study concluded there wasn't evidence of a connection. I mean, what's your reaction to this?
So Lynn Redwood will be doing that presentation. She's been an anti-vaccine activist for 25 years. She claims that thimerosal, this ethyl mercury containing preservative that was in vaccines 25 years ago, but isn't in vaccines given to children today, that caused autism and a variety of other problems, which isn't true. So if you're an anti-vaccine activist, what do? You either point to studies that don't exist, you misrepresent studies that do, or you point to some methodologically flawed study that is so poorly done as to be uninterpretable. That's been the anti-vaccine playbook for decades. And now, unfortunately, the anti-vaccine activists who've been shouting from the sidelines for years are now in a position to make policy, public policy. And I think our children are going to suffer this.
And here's kind of the crux of it. Most people don't know about ACIP, don't watch the meetings, don't look at the CDC website, which does provide, actually, you can go there and look for the conflicts of interest that they are required to report. Most people do not know about it themselves. Talk to me about the influence of this committee and what impact you think now this new version of ACIP will have.
Right. So the people who do look at the committee are insurance companies, because when a vaccine is recommended, then it will be insured by insurance companies. And the other groups of people that look at it are the scientific and medical community, which now, frankly, can't trust that committee. And there are a number of groups that are trying to put expert committees together that will at least run parallel to that group that you can trust, because I think now the ACIP has lost the trust of the medical and scientific public.
Dr. Paul Offit, thank you very much for coming on today.